They are here to talk to us about what we need to do to be prepared and what we can do to better the health of our community with COVID-19. The title of their presentation is Be Prepared, Not Scared, which I really appreciate because I think that there's a lot of uncertainty in this time. So I'm going to go ahead and hand it over to them. I'm going to become small and let them introduce themselves and get started with the presentation. One thing I did want to mention, if you have questions as we go through the live, please use 3 question marks before and after the question. If it makes sense to interject during the presentation, then I'll go ahead and ask the questions, but some of them we will hold to the end. So feel free to comment, put some smiley faces on there for us so we know you're watching. So without further ado, I will hand it over to you guys.
Hello. Yeah.
Hi, I'm Phillip Rhoads. I am board certified in internal medicine and pediatrics. Been in practice for about 17 years. We started NoCo Primary Care a little over 2 years ago. We are based on the direct primary care model, which is basically we are a membership-based clinic. We don't bill insurance, and we feel that allows us to provide much more personalized care, spend more time with patients, and also looking at the sort of the financial aspect in medicine, and we want to provide excellent care and be aware of sort of costs, and that's kind of the basis of our clinic is to spend more time and to have a clear idea of what things cost and give patients an easier way to access care.
And I'm Sarah Kray. I am a PA or a physician assistant. I have been in practice as an outpatient family practice or primary care PA for about 13 years now. I'm just really grateful that we're getting this chance to come and speak about this because I think, like a lot of us, we're all experiencing some level of anxiety, and there are legitimate concerns out there. But our whole goal tonight is to really give you some tools, to some practical advice that you'll be able to take, and hopefully that is a more empowering position to come from, where you have information and you're able to take that and feel like you have some control over things. So hopefully we achieve that tonight. We'll go back and forth talking about different aspects of coronavirus and COVID-19. So I'm going to start out first by talking about just some general things about the virus. What a virus is, if we get really basic and go back to our microbiology, a virus is basically just a little packet of genetic information. It's interesting because it doesn't have the machinery within its own entity to replicate, and so it needs hosts like humans or animals, where it takes over our cells. It uses our machinery of our cells to replicate itself. Now, a couple of little pieces of information just to clear up some of the terminology. The name of this new coronavirus is called SARS-CoV-2. So if you've heard that term, that's the actual name of the virus. And then when we talk about COVID-19, that is the name of the clinical disease that the virus causes. We have about 7 coronaviruses now that infect humans, and this one is what we call a novel coronavirus, and that just means new. It means that kind of in human history we have not been exposed to this virus previously, which is why, unlike other viruses where we have some type of immunity or some type of exposure, all of us are susceptible to this virus at this point. We know that this likely came from another animal. Bats are the most likely animal that they came from, and there was probably an intermediate host between bats and humans until it got to us. A lot of people have compared this to influenza, which, as we know, is a is another type of virus that infects millions of us a year. We have, just this flu season, which, 2019 to 2020, there's been, the estimates anywhere from 34 to 54 million Americans have gotten influenza. And the estimates of deaths from influenza this year is anywhere between 23 and 59,000. So influenza is certainly a comparable virus just in terms of effect on all of us. But there's some key differences between flu and this coronavirus. One of the things with that makes this a little bit more frightening for us is we just don't have the knowledge and the time and experience as we do with influenza. And so I think that makes it a little bit more concerning for a lot of us. We also know that both viruses can affect vulnerable populations. Coronavirus is not affecting our young population as much as flu. Usually with flu, kids under 2 are particularly susceptible to complications. And luckily that's not the case with this one, or not what we've seen in the data. Another thing that we talk about the differences between this coronavirus and influenza would be some of the transmissibility, how it spreads and why it spreads more easily than flu. There's a little epidemiological term called R0, or the reproductive number. And what that is it's a number that we assign to certain illnesses or diseases that tell us if one person has this disease, how many people are they likely to infect? So over the years, we've found that the influenza reproductive number is 1.4. So that means if one person is infected, they're likely to infect 1.4, if you can, divide people up in tenths. So what that means is if you imagine like your March Madness bracket, if you have one person that infects 1.4 people and that happens 10 times in a row, we're looking at about 29 people after 10 rounds of that. As a comparison, the coronavirus, we don't know the exact reproduction number with it, but a conservative estimate is somewhere between 2 and 3. So if we took 2.2 as a reproduction number, and we did that 10 times, so one person infected 2.2 people, and then each of them infected 2.2 people. By the time we get to 10 rounds of that, we're up to about 2,600 people. So that's a big difference in how that transmission is different between those two. So they both cause very similar symptoms, which is one of the reasons why it's difficult to distinguish between the two. And I think next we'll move into maybe sort of along the same lines of transmission and how the SARS-CoV-2 is being transmitted these days.
Yeah, so to talk about how we protect ourselves and how we protect our family, and what are some principles that we can hang on to that can kind of help us with that. One of the things that the virus has going for it is that we can't see it. It's small, and unfortunately we can't test widespread. So there's this fear-invoking sort of aspect because it could be anywhere and we just don't know. We can't see it. One thing we have going for us is we have a higher intelligence. We have a brain, and we can understand how this virus works, and we can understand how it's transmitted, and we can gain some control that way, and we can use that to limit how much damage this virus can do. One thing I'll kind of mention is every person, every surface. When we sort of think about this virus, we can sort of think about how that's transmitted and sort of use maybe that idea of potential sources for infection, not in a way that makes us paranoid when we think about every person out there could be a potential source of infection for us, but actually just the opposite, to give us maybe some knowledge and some control. When we understand how this thing works and we understand how it can be transmitted to us, I think that can take some of that fear part out on it. So how do you become infected? And to put it simply, this virus has to gain access to our respiratory tract, and that will do so through your eyes, your nose, or your mouth. So that virus, in order to do its thing and for it to reproduce, it has to gain access to one of those points into your body. And I think a lot of times we talk about this virus as like this thing is out to get us and it's alive, and we need to remember it is this chunk of protein and this code, and it's going to reproduce using a host's cells, just like Sarah was saying. But it's not. It doesn't have a mind of its own, and it's not evil, and it's not out to get us. It's just unfortunate that when you pair that virus that humanity has not seen with us, that we're having all these troubles with it. But so let's hang on to that it has to gain access through our eyes or our nose or our mouth. And so then how does that come? How does that transmitted? Well, one of the big ways is respiratory droplets. And so respiratory droplets are these just like it sounds, these droplets that are going to leave a person through sneezing or coughing or talking. So right now, as I'm talking, I'm probably spewing a lot of respiratory droplets on Sarah's computer. You're going to want to clean that later. Hose that down. But those things are, they have a mass to them. They're heavy. So gravity pulls them down. And it turns out that distance where those can travel out from someone is about 6 feet. So that's kind of where that 6 foot number comes from. And so when we think about 6 feet, that's that distance that those respiratory droplets can travel. And it's thought that to be at risk, you need to be within 6 feet of somebody for about 15 to 30 minutes. And so those respiratory droplets can actually make contact with your face and be close enough to your eyes or nose or mouth to be able to gain access to your system. Another aspect is we call fomites, and fomites are viable viruses. And so viable just means that able to cause infection. So fomites are when viruses are on a surface. So a countertop or a box or your hands or some kind of surface that then can be transferred to your eyes, your nose, or your mouth. And so that's kind of how you can become infected, how it can be transmitted from one person to another. You probably have seen some of these studies that talk about 72 hours. The studies vary in how long a virus can remain viable on a surface, depending on if it's plastic or cardboard or copper. 72 hours, I think, is a good number to hang on to when we think about protecting ourselves and thinking about a surface in that length of time. There's also, you may have seen some data on whether this can be airborne. There's been a couple studies, one out of Princeton, looking at how long the virus can remain aerosolized. And you may have heard this number, 3 hours. That really is something that hospitals and ICUs need to think about, but average people, when you're living your life, we're going to think more about those respiratory droplets and about those fomites or surfaces. There is a study.
Oh, sorry. I was going to just ask a quick question, if you don't mind, related to that.
Yeah.
One of the questions was about, is there a difference if you're inside versus outside in terms of like transmission? So are you more likely or less likely to transmit the disease if you're inside?
Yeah, I don't know that there's good. I don't know if good data on that. I think there's some suggestion that outside is lower risk, right? So if you're inside with somebody and we're talking about these respiratory droplets, you're likely to be closer, just because logistics of a physical space. If we're in a room, you're probably going to be closer to somebody. You're not going to have the advantage of maybe air movement or sunlight. And there's some thought that those things help with making this virus less viable. But do you have any input on that, outside versus inside?
My other thought would be just inside we have more stuff for those respiratory droplets to get onto, and then we touch our face. Whereas outside, if we're not around a lot of things, it's just going to fall to the ground and not necessarily be transmitted as easily.
Yeah.
It's another thought.
That makes sense.
Yeah.
So having sort of talked about how we're infected, how it's transmitted, then what do we do to protect ourselves? I think, and I thought we'd break this down into when you're outside of the home and when you're inside your home. And when you're outside of your home, let's keep in mind that every person, every surface, and every person includes me. I can be a risk to myself, and we'll talk more about how that works. When you're out, we're all staying at home, but we have to go out to go to the grocery store, or some of us are still going to work. Keeping that 6-foot distance from every person helps to reduce our risk. And I think it's important to remember that it's not this virus is not taking flight off somebody and chasing you down. And there's not this pigpen-like cloud of virus around a person. That's from Peanuts, right? Do you remember Peanuts?
Yeah.
All right, so if you're 30-ish and above, yeah, okay, probably remember Peanuts. But yeah, so remember, those respiratory droplets are coming out, so they're likely in front of a person, right? So that's kind of why we want to keep the 6-foot difference, 6-foot space between yourself and someone else. And then we want to think about surfaces. So every person, every surface, think about what you touch, what touches your face. So your hands, or your phone, or your coffee cup. So if you can't be sure that you haven't touched your phone with clean hands, let's say you're in the grocery store, and maybe you picked up a box of cereal and then you're picking up your phone to make a call, that's touching your face. So you've got to be really careful about nothing touching your face. So that's how these can be transmitted. My beard has never itched as much as it has since this has been going on. We're all paying attention to how much we're touching our face. Sometimes that can make you want to do it even more, but really try to be not obsessive, but be thoughtful and keep that in mind about how you could potentially introduce this virus to yourself. Washing your hands, using hand sanitizer. Hand sanitizer works really well for killing this and activating this. So that's a good way when you're out. What about masks? Should you be wearing masks? Masks can be helpful to remind you not to touch your face. They can be helpful for catching respiratory droplets that I might produce if I'm wearing a mask. I'm not as likely to have that come out if I sneeze or if I cough. Probably masks aren't going to offer you a lot of protection. Certainly not licensed to be closer than 6 foot to a person, because those respiratory droplets can get around that mask. So, I think if it makes you feel better about wearing that, if it gives you sort of some reminder not to touch your face, that can be helpful. But don't rely on it for protection. What about gloves? Should you be wearing gloves when you go out? If you put on a pair of gloves, just remember those are now your hands. All they're doing is protecting your skin. So if you have gloves on, you can still touch something and transfer virus from one surface to another. You can still touch your face. All they are is your hands. It's probably useful if you're going into some place and you're going to be touching things, and then you're going to leave and peel those off before you get back in your vehicle or something. You still want to wash your hands after taking them off, but probably washing your hands or using hand cleaner is a bigger a more important thing than wearing gloves. Gloves might give us a false sense of security, but just remember they're just as much capable of transferring virus. When you do go out, we're probably going out for groceries, going out to work, going out. Maybe you're getting takeout, maybe you're getting coffee. When you remember that every person, every surface. So if you're not sure if something's been touched or somebody's been around an object for 72 hours, just consider that if you touch that, then that's potentially infectious. If you get some coffee that's been handled, just consider before you touch that to your face or you touch your hands to that that surface could not be clean. So we're going to link, or we didn't have a link on our website to a good video from a doctor in Grand Rapids, Michigan, and he kind of talks about applying the principle of sterile technique, something that's used in medicine, to bringing food into your home or bringing takeout into your home. And I think there's some good information on that. It turns out food is a pretty safe bet. It's the containers that it's held in. So just be thoughtful about that when you bring anything in. Just think about the container and think about the surface and making sure you're cleaning your hands. If you get some coffee, you might have your own clean cup open and take that takeout coffee, open it, pour it in, then wash your hands and go for it. Enjoy your coffee. But just kind of keep thinking about surfaces. That's kind of when we're out. What if we're at home? And still those same principles apply. I think you're going to talk about this more, but there's some thought that people might be infectious right at the start of this virus and maybe before symptoms. So you or a household member could be developing this infection or could be contagious. So even in your house, keep these same principles of keeping surfaces clean and thinking about what you touch. My son asked me to get him some water, so I took his glass and put it up to the refrigerator and pushed the little lever to fill it with water. And then I had the thought, so he's drinking out of that glass. I just touched it to the lever on the refrigerator. Now the next person that goes to fill up a glass by touching that same lever, you've potentially transferred, made contact between those surfaces. So we just kind of have to think about that more now, about what we touch and how we're touching. We will talk about this more about what to do if you do have an infection, but in your house, it's not an absolute that if somebody in your house, if you suspect you have COVID, that everybody's going to get it in your household. There are steps you sure can take, and that still is ideally having, if you suspect that you could have COVID, is try to have your own bedroom, try to have your own bathroom if that's possible. Clean every surface you touch. So doorknobs, counter surfaces, sink handles, countertops, toilet flush handles, whatever you call that. But kind of keep those things in mind. And that's where a mask in the house might be a good thing. If you're out around the family, try to keep that 6 foot distance, be mindful of every surface, but the mask can be helpful if you do cough or if you're just talking or sneezing, that's going to catch those droplets. That's a little bit about how do we protect ourselves? How do we protect ourselves from a grave outcome with this? We're learning more about that, but there are some principles that you can start now that we all should be doing to reduce our risk. Making sure we're healthy, we're eating a healthy diet and lots of veggies and following a good healthy diet, and maybe a diet with healthy meats, fish, low sugar. So we're getting a good healthy diet. Don't inhale anything unless your doctor prescribed it. So vaping, smoking, anything that could be harmful to your lungs, now is a good time to stop, because it's definitely the biggest risk with this is lung issues and that pneumonia that can happen. And we want to do everything we can to stack the odds in our favor for having good, healthy lungs. Regular exercise, 30 minutes, 5 times a week. there's been some reports about avoiding strenuous exercise. If you're boot camp level Marines, that kind of strenuous exercise, yeah, maybe you want to tone that down a bit. But for most of us, keep on your same routine or try to shoot for that goal of 30 minutes 5 times a week to help get a healthier heart. And if there's some blood pressure, to help manage that as well. Both those things seem to be important. So I think just in kind of in summary of how do we protect ourselves, remember that keep your hands clean, don't touch your face, keep 6 feet from other people, do some random washings of your hands. As good as we try to be, we're going to make mistakes and touch something, and that's kind of where that other aspect of not touching our face can kind of come in. And just remember that we're smarter than this virus, and we can use our brains and use our tools to kind of help us protect ourselves.
Yeah. I think those basic principles and those basic rules, they seem so simple, but it really is, touching a surface, touching your face. Like that's, if we can eliminate those, it feels more manageable, right? It feels like we have some control over this, because we really do. Next, we're going to jump into what to expect if you do get sick. What does this look like in real terms of what symptoms you might develop? So today, right now I'm going to talk about just a typical course. Obviously, there's going to be variations of how this presents in everybody, but the typical course, the incubation period, or the time from when you get exposed to when you develop symptoms, is somewhere in the range of 2 to 14 days. The average is about in the 5-day range, and that's where the quarantine recommendations come from as far as 14 days, because 99.9% of people will show symptoms after 14 days. I think even one of the statistics I read was about 97.5% of people are going to show symptoms within the first 11 to 12 days. And fever is usually one of the first symptoms that shows up. It's usually an abrupt onset, kind of like I was feeling fine, and then all of a sudden I'm not feeling well. And the fever can actually be fairly high. It can be 102 to 104 range. And when you have a fever that high, you usually feel very crappy. A cough, shortness of breath, trouble getting a deep breath in, maybe some tightness in your chest. Those tend to develop over the next several days after the fever. And we're also learning about some other symptoms that aren't quite as that aren't as common but can present. So things like diarrhea. I've seen varying numbers, but some numbers say up to 50% of people might develop diarrhea, and some reports are that can be one of the first symptoms that show up. Another interesting possible symptom is what we call anosmia, which means lack of smell, or another great medical word called dysgeusia, which means affecting your taste. I don't know how to pronounce it, but we'll just go with that. And then some sore throat and nasal congestion, like a lot of respiratory illnesses that we all deal with. And really, one of the things that we all have to remember, we have the news about all of these terrible outcomes, but the vast majority of us, about 8 out of 10, are going to have in that mild to moderate range of symptoms. And that's going to be symptoms that we are likely going to be able to manage on our own without going to the hospital, maybe with the help of a healthcare provider, but not necessarily in person. Out of the people, unfortunately, there is about a 14 to 15% of people need hospitalization, and then maybe about 5% are going to be critical. We've heard these numbers thrown around, and it's just our normal psychology to focus on the hospitalizations and the critical aspect. But sometimes it's reassuring to remind us, nope, I'm more than likely going to be in that 8 out of 10. The people that are going to be fine. If you start having symptoms, I have a really good resource. It's a website, and we can post this afterwards, but it's Human Diagnosis, and the website is humandx.org. And they have a great little algorithm that you can go through where you put in your symptoms, your demographics, your underlying medical conditions, and it does spit out for you sort of an assessment. It gives you 3 things: if you should see a healthcare provider, if you should isolate yourself, and if you should get tested. So those are kind of the 3 questions that a lot of us have if we're starting to have symptoms. Now, to be sure, these are just general guidelines. These aren't medical. This isn't necessarily medical advice. We don't know your individual health history. So when in doubt, it's always best to contact your healthcare provider, whether it's your primary care physician or PA, if it is calling the urgent care and seeing if they'll go ahead and see you. A lot of us are doing virtual and telemedicine visits now to try to help protect us and protect our patients from exposure, so that's a great option. Unfortunately, as you alluded to before, testing has been fairly limited, at least in our area. I know we have people from all over the country that are tuning in, and so this may vary quite a bit from where you're at, but right now where we're at, the tests available through the health department are very limited, and when they are available, it's for hospitalized and patients and healthcare workers. I think as time goes on, we'll see more and more testing getting onto the scene that we'll be able to do here in the office, that will have less turnaround time. And I think that's going to be a really critical component to us mitigating and controlling what we can. So say you do get sick, and what should you do to treat yourself at home? Say you don't feel bad enough that you think you need to go to the ER or the hospital, and the recommendation is, nope, you need to treat yourself at home. So the first thing would be to treat the fever. When you have a high fever, you're more likely to get dehydrated, and you're more likely to just feel really bad, whether it's body aches or sensitive skin. So bringing that fever down can be really helpful. There is a lot of information going back and forth on the Tylenol versus ibuprofen debate. Initially, we got some reports out of France indicating that ibuprofen, when you are sick, may potentially make the disease worse. I think we've had some conflicting information come out since then. And right now we're kind of at the point where if you need to use ibuprofen, or for a reason that you aren't able to take Tylenol, because there's certainly some underlying conditions where you should avoid Tylenol, I myself probably wouldn't be afraid to take ibuprofen. If you can do well with Tylenol, I think that might be your first step. And then if you feel like that's not controlling it, or you need something additional, maybe use use ibuprofen as a backup. I don't know if you have any other thoughts on that. I also have had questions from patients asking, well, if I take ibuprofen for another condition that I'm treating, but I'm not sick, is it still safe to take ibuprofen, or am I putting myself more at risk of developing the disease? And that's not the case at all. If you're taking it for something else and you're doing well on that, there's no reason to stop or avoid ibuprofen if you're not ill. So supporting or treating the fever, you are most likely going to feel very tired, so lots of rest, staying in bed, and getting whatever support you can from the people around you. You mentioned if you're sick at home and you're self-isolating, you really should be self-isolating from your family members as much as possible. I know that's hard if you're a parent, taking care of kids, but if you are able to have limited contact, and if you and the people caring for you can wear a mask when you need to be in close contact, that would be ideal. Fluids are going to be really important, staying hydrated, and using other over-the-counter meds is certainly an option, whether it's cough drops or cough syrup like Robitussin. So if it helps you, if it's something that you use typically with other respiratory infections, that would be okay to use. So a typical course, you should start to feel better if you are in that mild category. Around that 5-day mark, you might be turning the corner, fever might be getting better. One thing to look for, though, is if that shortness of breath is worsening, especially in that, if you're at a week and your shortness of breath is worsening, that could potentially be a concern. And really, if we are trying to keep people that aren't critically ill out of the ERs, out of the hospital, the shortness of breath should be that one symptom that you got to watch carefully, and that would be a good indication to seek further treatment. So what that might look like in practical terms is if you're having a hard time getting a sentence out without stop in to catch your breath. If you get up and walk across the room and it feels like you just sprinted across the room, or you have to wait more than 30 to 60 seconds to catch your breath at rest. Now, I think some shortness of breath is pretty common right after you cough, but if you're not regaining that breath shortly after, that would be a concerning thing. And you can also time your breaths. Normal is about 12 to 20 breaths per minute, but if you're working really hard and breathing really fast and you're up in the 24 breaths per minute, that would be another concerning sign. So and then the last thing, just if you're sick, when would it be okay to leave home again? When would you need to when would you be able to break the self-isolation? So the CDC is now recommending 3 things to break self-isolation if you're home. At least 7 days have passed since your symptoms have started. If you're fever-free without medication for 72 hours, so that's 3 days, you haven't taken any Tylenol and your fever hasn't come back. And then also your respiratory symptoms have improved. And I think we are talking way more than we planned on it, but we can kind of move to more of the Q&A. We have some questions that people sent in already, and we'll kind of go through those and just do a brief answer for those questions. And if anybody has any more questions, please chime in.
First question, I'm a healthcare worker and I have a sore throat and fatigue with no fever, no cough, and no body aches. Should I report for work? And of course, we can't give specific medical advice, but our tendency is to work through it and to be, to toughen up and keep going and push through it when we don't feel well. And I think this is a time when we that toughening up means paying attention to symptoms and possibly staying home instead of trying to push through something. Most of the healthcare workers are one of the ones that can access testing, so that could be an option for somebody in that position, and definitely contacting employers and these health systems. Hospitals are still going to have sort of criteria for reporting to work, but definitely let your supervisor know. And this is just one of those where we unless we can prove otherwise, we have to sort of be very suspicious and a lot of times assume that it could be COVID and just be thoughtful about our role in spreading it or preventing spread.
Next question was, no concerns for myself, but I'm just worried about my 88-year-old mom, not knowing if my husband and or I could be infected and potentially pass it on to her. Now we know that our older friends are at a higher risk of not only getting, not necessarily higher risk of getting the disease, but higher risk of having poorer outcomes. And so I think this is a legitimate concern, those elderly people in our community and in our families. We do know that you can be asymptomatic for the first couple of days when you're infected. So the 1 to 2 days where you could be transmitting it without knowing that you're sick yet. And so for that reason, I think we have to be extra cautious with our elderly friends and family members. If there's no way to avoid contact, just practicing going back to those basic principles of washing hands, staying 6 feet away. I think one of the things that is kind of tragic about this is that isolation, though, that a lot of the elderly people in our community are going to experience because of this. So continuing to contact people by phone and just making sure that they have everything they need, I think can be ways that we can support them without necessarily coming into contact with them and putting them at higher risk.
How can I be a responsible information consumer and not be overwhelmed by it all? And this is a big one. We're in a time when there's so much uncertainty and so much we don't know, and it's tough to exist in that world where we don't know, and that drives us, I think, to get more and more information. We want more and more information, and there is plenty of information out there on Facebook and on the news channels. But I think it's not always information that's right and trustworthy, and maybe there's good information, but it's easy to interpret it wrong or apply to the wrong set of circumstances. The CDC website has got good information and addresses a lot of questions and concerns. State and local health department websites, I think, are good sources. A few of the universities have put out sort of summaries of the current state of knowledge as relates to this. I think it can be good sources, but sometimes you got to step back and don't let yourself get overwhelmed. Try not to go down a rabbit hole of chasing information, and give yourself a break at times. Maybe even set a time limit, and you're going to shut it off and go watch Netflix or something. But I think it's important to pace the rate of information coming in to your brain, and use your judgment on whether or not something sounds like it makes sense, and consider the source.
Yeah. I know for me, I have set aside like COVID-free days on the weekends. You know, we deal with this all week, and sometimes I just say, okay, I'm gonna not like go online and look at anything for a day. And it really is like, if you get outside and you see the sky and the trees, you're able to kind of get away from it for a little bit. So that's always helpful for me. Couple more. When will it really peak in rural areas like mine? No ICU beds here. And I think that came from somebody in Kansas. And that's really difficult to know. We have very smart PhDs, epidemiologists looking at all of these models and trying to predict these things. And we just don't know. I think for those people in rural areas that it hasn't really hit yet, we hopefully the early precautions that we're taking, the social distancing, and everybody being aware of that, hopefully it won't see as drastic numbers as places that were hit early on. There is a great website that we'll put up too that does give state by state projections. Obviously, these are all projections, but the best guess scenario. And we'll put that website on, but just real quick, it's covid19.healthdata.org/projections. And then let's do that question, and then we'll maybe wrap up.
Okay.
Does that sound like a plan? I think a lot of people are wondering about that.
About if I had it once.
Yep.
So question, if I had it once, if I get COVID once, can I get reinfected? And we don't know the answer to that. We do know that people are there's kind of two groups of antibodies that people will generate. There's the acute antibodies. They're called IgM. These are the ones that when you're exposed to something new, your body begins with those. Then it starts making IgG antibodies, and these are sort of the memory antibodies. And we do know that people make those, but it's not clear that if that offers protection. It's not clear that you're immune, and if you are immune, for how long. We just don't know those things. I think there's some suggestion that yes, there's probably some protection, some immunity, but it's really not clear how long that could last.
All right, and this is the last question that we'll answer, and this is one of the most important questions, so pay attention. What are the best types of jokes to tell during quarantine? Inside jokes. We saved the best question for last.
There you go.
There you go.
Thank you. No, that was wonderful. I've been watching the comments. I haven't seen any other questions pop up. But this has been really helpful and really thorough. It's good to know that it is a serious disease for a small portion of the population, but it's important for us to keep our distance so that we don't spread it to those people. And also, it sounds like it's not a lot of fun to have, even if you aren't going to the hospital. So
yes, that is true. I have heard some people say, like, if I am considered mild, if anybody's had real influenza, you feel pretty bad for about a week or so. And when they say mild symptoms, it's more a matter of you're not getting pneumonia, you're not struggling to breathe, you're getting enough oxygen. It's not necessarily that you just have the sniffles. It can still affect you. Mm-hmm.
Yeah, that's really, really good to know. So yeah, I appreciate your time. I know that you guys have been really busy yourselves as healthcare providers on the front lines with lots of questions. And I'll post a NoCo Primary Care website just if anyone who wants to check them out. It's a really great resource here in Northern Colorado. Not as great if you live in Philadelphia or Kansas probably, but for people who live in Loveland and Fort Collins and even Greeley, yeah, you guys are really great to work with. So do you guys have any other last minute comments?
I don't think so.
Thank
Thank you.
Yeah, thanks for putting it all together. We really appreciate it.
Yeah.
It's a great way to bring people together and get information out there.
Yeah.
So
yeah, well, we certainly appreciate it. And for everybody else, just so you guys know what's happening the rest of the week, tomorrow we have children's yoga, I believe. Let me double check. Yes, children's yoga. So Isabel Van Dyke works with Sun Breath Yoga. She's a yoga instructor there. And she has put together a children's specific yoga. So if anybody out there has small children at home, I have an 11-year-old who is very sad that he can't go outside and play with his friends. So having some indoor activities, I think, is going to be helpful. She's going to specifically focus on animal poses. And so it'll be really fun, even if you have pretty young kids. She's designed it for ages 4 through 12. So join us tomorrow night live at 5:30 for yoga. If you have any other additional questions about COVID-19, I'm happy to see if I can help get the right answer from these guys for you. Send me a message or continue to use the Facebook page where we're moderating that so we can see what's going on. So if nobody else has any questions, then we can let you have your evening, and hopefully it's COVID free for the rest of the night. We'll all take a break from this for a while. So
Thank you.
all right. Good night.
Bye.
Thank you so much. We will see you tomorrow night.
Bye.
Bye.